This chart tracks the adoption of digital mental health apps and online therapy platforms in Singapore. We are seeing an exponential climb. The appeal makes total sense. You eliminate travel time, bypass waiting rooms, and get immediate flexibility right from your couch. But that frictionless access raises a critical question. By prioritizing the sheer convenience of logging in from home, are we actually compromising the clinical effectiveness of the care we receive? To complicate things further, the recent explosion of generative AI has a lot of people quietly wondering if they can skip the human therapist entirely and just talk to a chatbot. Effective therapy requires a controlled physical environment where a professional can monitor your nervous system, notice your breathing shifts, and maintain strict clinical safety parameters. Choosing an unsuitable format carries significant risk. It can actively compromise your safety during a vulnerable moment. We must systematically evaluate when to use online, in-person, or AI support. Let's define the baseline first. When we talk about legitimate online therapy, we mean live video sessions with a qualified human clinician. For mild to moderate anxiety, daily stress, or workplace burnout, this remote setup is highly effective. Take a look at this split screen. On the left, you have a typical shared household, or HDB flat in Singapore. Multi-generational, thin walls, people moving around. On the right, a quiet, isolated clinic room. Online therapy demands a perfectly private and stable home environment, a condition that many people here simply do not have. When you travel to a physical clinic, that commute acts as a mandatory decompression space. You leave your usual environment, process difficult emotions in a dedicated container, and have time to put yourself back together before heading home or returning to work. Being in the same room also allows for somatic visibility. A therapist can observe how your entire body holds tension, how your breathing shifts, and subtle signs that you might be disconnecting. A restricted webcam angle showing only your shoulders and face completely misses those cues. If you are sitting in your bedroom terrified that a housemate or family member might overhear you, you are going to self-censor. You will actively avoid discussing critical, sensitive topics like shame, domestic conflict, or abuse. While firing up a laptop saves you 45 minutes on the MRT, the absence of a dedicated, private physical space often blocks the deep vulnerability required to make actual therapeutic progress. The rule here is straightforward. Your specific diagnosis and risk level dictate the modality you use. Let's evaluate how 4 distinct pathways alter this digital trade-off. Starting with trauma. For a patient beginning their recovery, sitting in the familiarity of their own home can initially feel much safer and more grounded than walking into a clinical office. However, if you open up highly painful memories on a video call, close your laptop, and are immediately left alone in an unsupportive environment, you risk dangerous emotional destabilization without a professional there to help you regulate. For adults managing ADHD, online therapy removes massive logistical friction. You eliminate the stress of commuting and time blindness, making it far easier to show up for the appointment consistently. But that home environment introduces severe screen fatigue, incoming notifications, and the constant temptation to multitask during the session, which fractures the focus needed for the work. Couples therapy is another area where digital convenience is huge, especially when 2 partners have entirely different work schedules or are in different locations. Yet, if the conflict is high, a screen strips the therapist of the physical authority and spatial awareness necessary to safely manage physical intimidation, coercion, or severe emotional escalation between partners. Finally, looking at psychiatry, online check-ins are incredibly efficient for routine psychiatric medication refills if the patient is already stable and established with their doctor. Therapists, however, cannot prescribe medication. Furthermore, remote video calls miss critical physical vital signs and direct examinations required when conducting a brand new medical assessment. As the complexity or risk profile of a diagnosis goes up, the absolute necessity for a controlled in-person clinical environment easily outweighs the logistical benefits of digital convenience. Now look at this rapid processing. This is why AI chatbots have massive appeal. They offer a frictionless, instantly available 24/7 sounding board when you are struggling at 2 a.m. These systems have legitimate utility. They are excellent tools for generating journal prompts, organizing your scattered thoughts, or helping you compile a clear list of questions before you meet with a human professional. The critical failure point is that AI entirely lacks clinical judgment. It cannot read subtle human risk cues in your voice or face, and it holds zero ethical accountability for your well-being. Relying on a chatbot during a crisis, a period of psychosis, or severe depression is dangerous. The AI can confidently over-validate unsafe beliefs or delusions, providing responses that sound comforting while offering absolutely no human relational safety. That is why any digital mental health care requires a mandatory pre-flight checklist to vet human-led online therapy before you ever log into a session. You need to ask specific questions. What are the platform's exact data privacy rules? What is the emergency protocol if the video call drops during a crisis? And what are the specific clinical qualifications of the person on the other end of the screen? AI is exclusively a preparatory tool to help you get ready, not a clinician. And even human-led digital care demands rigorous upfront vetting to ensure you are protected from a catastrophic safety failure in a vulnerable moment. Choosing a therapy format is a critical medical decision based on your environment and symptom severity, not a lifestyle preference. Here is how you evaluate your options. You are a go online candidate if you are dealing with mild to moderate symptoms, have a guaranteed private home environment, and are primarily seeking daily coping skills or maintenance check-ins. You must go in person if you are navigating complex trauma, severe depression, intense family conflict, or if you simply cannot speak freely and safely in your own house. For many, hybrid therapy is the optimal middle ground. You start in person to establish trust and physical containment, move online for flexible maintenance sessions, and return in person whenever deep emotional work is required. And regarding artificial intelligence, the rule is non-negotiable. Never use AI to replace human clinical care, especially during moments of crisis. AI helps you prepare, humans help you process. If you are ever in immediate danger or experiencing a crisis, do not log into an online platform or talk to a bot. Contact emergency services like Samaritans of Singapore or the Institute of Mental Health immediately. Navigating these modalities takes careful thought. To dig deeper into these trade-offs and make an informed, safe investment in your mental health journey, read the full breakdown at flockcare.com.sg/insights.